Now, what homocysteine does, and 90% of what Americans eat is processed food, but it actually turns your arteries into rusty pipe. So when those pipes get rusty, now things can stick to them. What kind of things? Well, cholesterol being one of them, okay? So cholesterol, if it doesn't have anything to stick to, your cholesterol could be 600. In fact, there are animals that have cholesterol scores as high as 600 that don't have heart disease. So cholesterol is not the cause of heart disease. They just discovered in the 70s that they can test for it. They also discovered that they have a drug for it. But there are many other indicators for heart disease, the main one being homocysteine, but they don't have a drug for homocysteine. But guess what works with to lower homocysteine is actually B vitamins. So if somebody were to do a good B complex with some folic acid and B12, you can actually keep that homocysteine in check. But then there's other things like C-reactive protein. I mean, there's a lot of research coming out now that it's not just the hard plaque type that causes a heart attack, but it's inflammation, which is caused from C-reactive protein. So they don't even, you know what, I was just talking to a doctor today. He was on a conference call with a bunch of doctors, and they said, why test for it? There's no drug for it.
Whoa.
Well, if they don't have a drug for it, they're not going to test for it. They're not going to test for homocysteine. They're not going to test for a lot of these different things because they don't have a drug. So let's just stick with cholesterol, even though they know it doesn't prevent a heart attack.
Talking about cholesterol, I'm a huge proponent of coconut oil. I absolutely love it. In fact, I just did a 3D test on the West Coast, and between having something we're going to talk about in a little bit and coconut oil, the doctor went in, and this is the best test in the country. He said, I've gone down to 1 millimeter in your arteries, and he said, I can't find a single trace of plaque. He said, even 20-year-olds don't have such a low amount. I tell you what, it really makes you realize how we have been sold a bill of goods. And now with the Codex Alimentaris bills coming out, they're going to make it tough to even get something as simple as vitamin C in an amount that can really do any good for your body. So we've really got to stand up against some of this legislative infringement on our liberties, because it absolutely is taking away some of our rights, some of our ability to be proactive. But you are doing some tremendous things in terms of helping people be alert to the actual status of their health, and there's something extremely affordable out there that you're working with. Now, the test that I did cost thousands of dollars, but you have an option that's extremely affordable and probably nets the same kind of results. Can you tell us about the digital pulse wave analyzer?
Sure. There was a study done, published in Circulation. It was done by 40 cardiologists, and these 40 cardiologists got together, and they called themselves SHAPE Task Force. SHAPE stood for Screening, Heart Attack Prevention, and Education. And what they basically concluded, and this is a report that was actually wasn't in Circulation, was in the Journal of American College of Cardiology. So this was 40 cardiologists reporting to their peers of cardiologists. And what they said was, we can save 90,000 lives and $21 billion annually if we do the following. We do non-invasive screening of asymptomatic men starting at age 45 and women starting at age 55. You see, the 300,000 Americans who die every year from heart disease, the first symptom is death. Now, you can't go into a doctor and ask for a CT scan or an echocardiogram or electrocardiogram or any type of heart test unless you're having symptoms. Because if you're not having symptoms, you're paying that bill because insurance won't cover it. You know, it's not necessary. So they're saying we have to screen people before it's too late. By the time they come to us, you know, there's very little we can do for them. You know, we're bankrupting the system, so we have to test them early on. Asymptomatic means no symptoms. Non-invasive means no needles, no catheters, no pain, no tears, nothing like that. So in South Korea, there was a machine developed for the military called the Digital Pulse Wave Analyzer that uses 130-year-old technology that Chinese, if you met with a Chinese doctor, he can feel your pulse and tell you exactly what's wrong with you. I mean, that's how advanced they are.
Goodness.
So it uses pulse wave technology and measures, actually, it looks like a pulse oximeter, hooks up to your fingertip, and uses laser light technology to penetrate the finger, measure the hemoglobin content within your bloodstream. And then it measures the speed, the volume, the resistance, the reflective wave, all these different things using mathematics. And in 60 seconds, will show exactly what your heart rate is. We'll show exactly the strength of your heart, which is equivalent to ejection fraction done by an echocardiogram. We'll show if there's an electrical disturbance that is causing arrhythmia, which an electrocardiogram does. It will show how hardened your arteries are, which there is no device that will show that. And it will show blockage in all your arteries, large, small, as well as your capillaries. All that in 60 seconds, give you a grade from A to G, A being really good, G being, a clinical event, and then we'll biologically age your arteries, all in 60 seconds. And the average test runs anywhere from $30 to $100.
I've had this test done, Dr. Harry, and it is an eye-opener. It is incredible, and as you said, no pain. And so yeah, that was a pleasant surprise. It actually is just a wonderful experience, and it even picked up on how hydrated my blood was.
Mm-hmm. And what's funny is if I'm doing a health fair or something and people walk by, my table, they'll say, "I don't want to know." I mean,
Whoa, you're
dumb
kidding.
is that?
Oh, my goodness.
Or they'll
Can't
say,
imagine
well,
that.
I just had a lifeline screening, or I just had a screening by my doctor. And, my answer to that is, well, let's look at a couple individuals who had the same thing. First of all, Bill Clinton went through a battery of tests. He's got the best health care plan in the country. It's free. He's got the best doctors in the country at the time. And they said, you're good to go. The next day he was having chest pain and ended up with a triple bypass.
Whoa.
Or out to poor Tim Russert. I mean, here's a guy that went through a battery of tests 2 weeks earlier and had a massive heart attack at work 2 weeks later. And they told him, there's nothing wrong. So, I mean, these tests aren't picking it up. This machine would pick it up.
Goodness. It's fascinating because we met with a gentleman who had a stroke, and the comment was made to him by this medical individual who works with your machine, and she said to him, we probably would have picked up. You might have had a stroke coming on, and you could have taken some preventative measures had you had this test beforehand. And, a stroke, it many times doesn't kill you, but what an aftermath to live with if that can be avoided. I just can't imagine somebody saying, I don't want to know, when you've just talked about some things that can be done to prevent it. It's incomprehensible. But what do you tell a person who doesn't test well?
It depends on what I see. I mean, if they have a serious arrhythmia problem, I might want them to go see their doctor,
Mm-hmm.
If they do test out of G, I might want them to go get further testing. But we do have a solution that I've had people that have had arrhythmias. I've given them something to try, tell them to come back in an hour. They come back in an hour and there's no more arrhythmia. Or if I have somebody that's arteries are showing major blockage and they're having chest pain, I give them the solution that chest pain is gone, much like if they took nitroglycerin.
Goodness.
So we have a solution that we work with that gives people a safe option that is non-pharmaceutical and non-surgery. In fact, I just had a gentleman have a heart attack at work, went in, they rushed him to the hospital, put in 2 stents, but they needed to work further, and he had what's referred to as a widowmaker, which is a very dangerous procedure, and they wanted to do a bypass, and they said, look, why don't you go home and get your everything in order, because, sometimes people don't survive the surgery. So he went home, went on a website that I have, and ordered some product, went on it, started feeling good, called the cardiologist and said, look, I'm not feeling too bad. How much time do I have? And the cardiologist said, well, I'll tell you what, come back in about 4 weeks, and we'll do a stress test. He went in 4 weeks later, and I have the actual document that showed what the cardiologist stated. But he said, whatever you're doing, keep doing, because you have great, the motion of your heart is perfect, the wall of the heart is nice, and your arteries are unclogged.
I love it.